University of Vermont Medical Center is a special place. It's the only academic medical center in the state of Vermont, and that means the hub of academic medicine is right here.
Our program is a categorical program. We have 4 years of residents that come in, PGY1 through PGY4. Our first year residents spend half of their year with the medicine department and half the year with the surgery department. And then our PGY2 through 4 program, that's our clinical anesthesia 1, 2, and 3 years, they're doing anesthesia. And so they rotate through all of the different subspecialties.
One of the keys to being a good anesthesiologist, or even a fellow if you're considering a subspecialty, is getting as many hard cases and as many different types of cases in residency as possible. Just the fact that we're a tertiary care center without fellowships just gives you this amazing breadth of experience very early on, and you develop comfort doing those cases very early on, and I think that's a pretty powerful thing.
Within the clinical context of clinical anesthesia, we don't have any fellows, which is amazing. Any patient that comes in, they're working one-on-one with the attending to be able to care for those patients, and I think it's a huge benefit of our training program.
It's a big academic center, but it's not massive. So you get to know all of the attendings, including all of the surgeons.
Our faculty here are very passionate about their careers and the types of anesthesia and projects they're involved in, but they're also very enthusiastic about supporting the things that I'm also interested in. I've been working on cardiac anesthesia projects, also intensive care unit projects.
And I got a lot of opportunities that I wouldn't have otherwise received, perhaps at another program. My pediatric fellowship application, I was very supported with all of my attendings, both with my application and advocating for me with the programs, but also in the operating room. They gave me the opportunity to operate as a fellow and as independently as possible. So I not only got to pursue my fellowship application, but I got to feel what it would be like to be a fellow.
There's only 40-some attendings here, so over the course of your residency, you'll work with almost all of them multiple times, and you get to know not just how they practice anesthesia, but also kind of their outside of anesthesia lives and kind of shared mutual interests.
We get to work with faculty every day in our ORs or in our intensive care units who are using point-of-care ultrasound, developing the curriculums naturally, but they also get to bring those curriculums to us early access.
Echo is something that is becoming more unique, and anesthesiologists are becoming really facile with the skill, and we're working to keep up with that and creating new things that we need to, including Echo. We have a wellness curriculum that we developed, and I think that we really work to make sure that we're keeping up on the edge of our programming and what's going to be important to residents who choose our program.
We value the education that we provide and the flexibility that we have to continue growing as a program and help you grow as an individual.
Being a small program with only 6 trainees a year and having the exposure to these trainers that have an incredible breadth of experience throughout their lives and careers, I think is one of the most important things.
I want them to aspire for the culture we have here and bring it elsewhere and continue the engaging education, continue the engagement on the human level, and to see that they feel themselves accomplished and more comfortable doing what they do.
We have really wonderful fellowship and job placement success. I think that's one of the benefits of the program as well, is that residents get early access for fellowship, but residents have been able to choose their job and get great fellowship placements, which I think is good, especially coming from a small program.
The promise that we make to our residents is when they leave here, they're going to be superb anesthesiologists, and hopefully they're going to have fun doing it. There's no question, being a resident is hard no matter what specialty you go in. But it should be fun, it should be exciting, it should be invigorating.
I think the uniqueness is our family-like approach and the culture. We care about each other at baseline. When we look for applicants who apply for this program, we really try to take a holistic approach. A number isn't everything, and even if you have the best board scores in the world, you may not be a person who is easily relatable and who's going to do well in our family. It's not to say we want people who are going to be academically successful. We also want somebody who's going to come in and fit well into our program, and so that's what we look for when we're looking at applications during the recruitment season.
So I remember looking at doximity And one of the comments from an anonymous person said, oh yeah, University of Vermont, good program. And I remember the phrase they used was a hidden gem.
All of my partners have interests and specialties that span not just here, but all over the globe, and all of us have chosen to come back here.
Yeah, it really does feel like a second family where you come to work and it just feels like a very natural environment to exist in, even as a learner.
I came to Vermont because I wanted to be at the University of Vermont for residency. When I came here as an away student, I saw how special it was, and this is what drove me here.
The best part of the residency program has to be the support that we have from our tight-knit group within our department. Our faculty know how to push us to be the best physicians we can be so that we're going to be strong anesthesiology attendings when we graduate from this program.
So I just want to say thank you to everybody for watching this video and getting to know a little bit more about our culture, our faculty, and our residents who you've been able to meet today. We would love to hear from you. You can reach out to us through our GME Anesthesiology webpage, and we look forward to seeing applicants here in the future, and hopefully we'll be able to train with you.